Okay, thank you everybody for joining us today. So before we do get started and have the discussion with Dr. Alozie and Dr. Menna, just a little bit about what we do here at the center. This is the PowerPoint. So our vision here at the Chamber, the vision of the Chamber is to continue being the core component for the El Paso region in fostering entrepreneurial economic development where our existing companies are growing, where our entrepreneurs are reaching new horizons, and where our small minority and women-owned businesses are thriving and are outpacing all other markets. And of course, some of the benefits of being part of the chamber, we do networking, business development, financing, we have procurement opportunities, and we also advocate for your business. Alrighty, and then these are some of the ETA centers. Now, of course, with these centers, they are all found in the same building here on Missouri Street. We have the Women's Business Border Center, which I am a part of. Now, this is a joint partnership of the El Paso Hispanic Chamber and the United States Small Business Administration. We also have the MBDA Business Center as well. Now, that one's funded by the U.S. Department of Commerce, and it's operated by your Hispanic Chamber. And then finally, we have the MWEDC Center. Now, this is funded by the U.S. Department of Commerce, and it's operated by the Hispanic Chamber. And now this is our team for the WBBC team, the Women Business Border Center. We have Melissa as our business development, Ms. Mary Helen as our Women Business Project Director, Dominique that works with the COVID marketing, and then of course, I am the project coordinator for the COVID response team. Okay, so I don't think Dr. Alozie is back, but while we wait for Dr. Alozie, let's go ahead and have Dr. Menna present herself and then just tell us a little bit about yourself, Dr. Menna.
Great, thank you. Thanks for inviting me. So I'm Christina Menna. I am from Indiana originally. I have been in El Paso now 20 years, marked my 20th summer this summer. By training, I'm an environmental microbiologist where I studied waterborne and foodborne pathogens, and in particular viruses. So mainly viruses that are transmitted through those routes and through those sources. My specific background is in human health risk assessment, where I address different factors related to people and then the environmental hazard, and model the chances of someone becoming infected or ill or even dying from that exposure. And so I'm here, as I think was on the slide, I'm the dean of the El Paso campus of UT Houston School of Public Health. We have 6 campuses around the state, including one in El Paso. This one's been here since 1992, and we offer graduate degrees, both the PhD and the MPH, which are both public health graduate degrees. So thank you again for having me.
Oh, yes, of course. Thank you so much for joining us. And then now, Dr. Alozie, if you want to tell us a little bit about yourself.
Yeah, good morning. My name is Dr. Alozie. I have been in El Paso now 12 years, originally from Nigeria, but grew up in Minnesota. Worked at Texas Tech for a while, worked at Del Sol during the height of the pandemic, and now back to my private practice. So look forward to talking to the group.
Okay, awesome. So as you guys can see, we have great experts on this webinar today. So this is going to be more of a Q&A type of session. So I'm just going to ask you guys a couple of questions. I think that these are very common questions that everybody's been having. And of course, each one of you guys can just give us your input on what you see yourself as the experts in the area. Well, I guess first of all, let's start with a simple question. What is the one thing that you think is the biggest misconception, whether it be about the vaccine or about COVID itself or the new Delta variant, that you think is important for people to know, like, this is not true, or any doubts that you think are to be addressed?
Dr. Menna, you want to start us off?
Sure. For me, I think it's what's been presented in the media as breakthrough cases, sometimes you'll hear them say breakthrough infections. And I think one of the biggest misconceptions in talking about this virus is the understanding that there's a difference between infection and illness. So someone could be infected, meaning that a virus infects their cells, it enters their cells, and that's what it's going to require to do in order to replicate. Doesn't mean the person is going to experience symptoms, therefore become ill. And when you become ill, then you become a case. So when we talk about the vaccines, and sometimes the term used is, oh, we have another breakthrough infection, it implies that the vaccine didn't do its job. And the vaccine, as we've also heard, I think through a lot of messaging, is that the vaccine can prevent and reduce the risk of severe illness and hospitalizations. And it is showing to do that. Didn't say it wouldn't prevent exposure, right? Didn't say it would prevent infection. So infection and illness are two very different things. And so I caution those who think, well, why should I get vaccinated if I'm still could get infected? And that's not the way to look at this. You don't want to be infected, because if you do become infected and we continue to not have everybody vaccinated, it's going to give the opportunity for that virus to still be transmitted in the environment. And whenever it has a chance to transmit, it has a chance to mutate. And then we're going to produce, more variants that could be resistant to the current treatments and vaccines we have.
And
Yeah,
then,
I agree 100% with that. I think the other thing too, Dr. Menna and the group, is that a lot of times you're going to hear the numbers of breakthrough cases, but I always caution people, and I think historically we're just not great at math in the United States. We're only hearing the numerator, right? Remember that there's a denominator, right? And so in the United States, we've had about 7,000 breakthrough cases as of the end of July. It's important to note that the denominator there is almost 160 million. And so it's 0.00001% breakthrough. And so again, I make this really clear to people. If I gave you a 0.001% to win the Powerball, but I said you had to put $10,000 on it, if you think that's a good bet, then okay, breakthrough cases are a thing. But if not, I think, and this is really important for me as we sort of transition into what does life become, right? Now that we have an answer to all of these riddles that COVID has posed, life has to sort of try to get back to normal. And I think it's important for people to understand we didn't shut down the world and the country because of a cold. We didn't shut down the world and the country because somebody gets a fever for 2 or 3 days or misses work for a few more days. And that's not good, it's not perfect, but that's not why this happened. It happened because our hospitals became full, people got sick, and unfortunately a tragic amount of people died. And so when we have the answer to this, which is get vaccinated, it's really tragic that since Delta entered the United States, there's an estimate of somewhere between 100 and 150,000 people have died. Those are lives that did not have to die. It's understandable. Last year, we didn't have an answer to it, right? And so whether it was masking or social distancing, whatever you want to call it, some things worked, some things failed remarkably. But we have an answer to this now. And so I think it's important for people to sort of take it into context that as we go forward into the next few months and years, understanding that COVID's not going anywhere, the vaccines are still the answer.
okay, wow, yes, those were two amazing points and very true. That's probably one of the most talked about things is, for example, well, why get the vaccine if I'm still able to get it? Also, when they talk about those breakthrough cases, that's very true. A lot of people do use that as a way to get out of getting the vaccine because they are scared of, well, those cases, right? So I think then the next question, just for everybody here, is how do vaccines work exactly? What is it exactly that they're doing once we go ahead and get them? When you guys explain that for us, please?
Yeah, I'll take a first shot at that. So I think vaccines, and not to make this too complicated, but vaccines sort of tell your body what to do. And so think about it as an alarm system, right? So let's say, and not just for your house, let's say this is an alarm system to a bank, right? So there's the outside alarm system, which might be a motion sensor, right? And so when you get a vaccine, it's essentially a picture, right? It gives your body a picture of, hey, this is the intruder. This is what the intruder looks like. If this person comes around, protect us. The first line of protection against that intruder are the antibodies that you hear about. That's your external bank alarm system. It's the motion sensors, it's the cameras, it's the things that go on when somebody comes in the vicinity of the bank. But the next level, and I actually think this is a lot more important that we don't talk about enough, is what's called B and helper and killer T cells, right? They're a robust piece of our immune system. And that picture that your body gets triggers those gentlemen or gentlewomen, depending on which one you want to use, to say, hey, if this guy breaks through the front, you got to go get him. And the B and T cells not only come with a lot of armed guards, they have a lot of weapons and AR-15s, right? And so you may be able to break through the initial piece of the immune system, like we talked about the breakthrough cases, but then those B and T cells ramp up and they go attack the virus. And that's essentially what the vaccine is doing. It's giving your body a picture of what does this intruder look like. I think the other thing that people need to understand as we talk about variants and whether it's Delta Plus or Mu is that the picture, just like sort of Google Photos does or Apple Photos does, it looks at it and it will be able to identify multiple copies of it, right? So you'll be amazed, like on your phone, right? You have a picture of you when you were 2, and Google Photos still says, "Is this you?" Right? That is also what your immune system does. It doesn't need an exact replica of the virus to work. It's able to picture you 10 years ago, 20 years from now, right? And so that's why the conversation about the variant, I get it, but our immune system is such an amazing and miraculous, robust system. It's able to adapt to multiple threats. And so that's why we get vaccines. We've gotten vaccines all throughout history. And it's also a good reminder, I think Dr. Menna can chime in on this too. Vaccines are actually what has helped us as human beings and our human population get out of the sickness that we had in the 1700s and 1800s and 1900s. People died at the age of 20 and 30 from things like measles and typhoid and tetanus. We don't have that anymore, primarily because of vaccines.
Yeah, I'll go ahead and add to that. Just, actually every Thursday I give a talk at Texas Tech for the medical school interviews, and I just talk about public health since we have a dual degree MD and PH, and we talk about how obviously medicine is so important in treating patients, but when we look at the years gained in terms of lifespans over the past century, much of that is due to public health prevention, and it's so difficult to measure prevention. That notion came out when I remember when in March 2020 and things were shutting down and folks weren't able to travel and go to conferences, and they're like, yeah, see, we'll probably cancel everything and then nothing will happen. And so, yeah, right. But how do you measure that nothing happened? And so it's difficult, sometimes to put a value on that. But if you look at the value of someone who never started smoking and the years that are added to their lifespan versus someone who started smoking and then is getting treated for the health consequences they have from smoking, it's just not even comparable. And then the other thing I'll add related to what Dr. Olozi said and talking about B cells and helper cells, right, it's a very robust and some of us are immunocompromised, but it's a system that is able to adapt. And so what's happening when we have these variants, the variants look very similar, may not be identical, and hopefully our immune system can adapt, but there is that concern that the variants will keep emerging and then maybe we won't have effective treatments. And one question I often get is, why do they keep changing? And so just to briefly mention, viruses are very simple structures, actually, even though they can cause wreak havoc in the human body. But they're basically just a piece of genetic material surrounded by a protein coat. And those of you who have seen pictures and images of the virus that has these spikes coming out of it, and those are the proteins, and that helps the virus attach to your cells and enter the cell. When it has to enter the cell in order to replicate, and replication isn't perfect. So when it replicates, the sequence of genes that I mentioned, that genetic strip, if you will, may not replicate completely accurately or identically. So it's going to have some components, a little different. It's going to make the virus maybe evade your immune system or look different, or maybe it's going to make it attach better to the host cells, like we found with the Delta variant. And I'm not great at analogies, but the analogy that I'll borrow from different sources that I've read, compares that genetic sequence to a sentence. And so, the sentence I came up with, let's say the sentence is, the house is on the street, and that's what's in SARS-CoV-2. And then as it replicates, suddenly that sentence now becomes, the mouse is on the street, and that H was changed to an M. And so it's a slight change. It's still a sentence. It's still, the coronavirus, but it's slightly different. And then lo and behold, what if that word completely changes to the cat is on the street? Maybe it's still in that family of viruses, but now it's another variant that's even a little bit more different. And so that's just something, to keep in mind. We want to prevent this transmission because it's going to then, reduce the chance of the virus continuing to mutate.
Okay, yeah, wow, amazing points there. Thank you so much for that. And I think those two analogies actually helped a lot, the sensory one and the sentence. I really love that. So another question I think that, well, at least I'm curious about is, for example, is there ever a situation where a vaccine is not safe, or where people should feel scared because the vaccine is not safe?
Yeah, I understand when people are worried about vaccines, and especially this was a faster vaccine rollout than we're used to historically. A couple of things. I think that the technology we have is different. We don't say that because we no longer use flip phones that we don't like our iPhone, that we don't consider it safe, right? It's just a different technology. It's a better technology. So we're using a different technology. And then the other thing about it is that we've now given out, I think, over 250 million vaccines in the United States. The safety signal is pretty clear. People that have allergies to the components, and there's a long list of components in the vaccine, should check with their physician before they take it. But again, there's a host of studies that have shown that even in people that have an allergic reaction to the components of the vaccine, they can take it safely, either by being watched, by getting pre-medicated with Benadryl or a steroid prior to the vaccine. And so on average, there are very few cases or situations where somebody should say, hey, I'm worried about what the vaccine will do to me. I think the other thing that was sort of out there recently, and a host of organizations have chimed in, is in pregnant women. That was the one that we really were sort of worried about, because obviously during pregnancy, people are concerned. But not just the American College of Obstetricians and Gynecologists have said it, CDC has said it, American Academy of Family Practice, a host of organizations. Because I truly do believe, and I see this in the hospitals all the time. Recently lost a 28-year-old that came in 29 or 28 weeks pregnant, delivered the baby, and 2 days later, she unfortunately passed away. She was unvaccinated, right? Those are the stories that we see daily in the hospital. And so again, I think 6 months ago, this might have been a different conversation. And I'm all about risk reduction and sort of helping people understand that because you're exposed to somebody with COVID doesn't mean you're going to get COVID, right? A lot of times you ask, we had a poll, American Medical Association, we asked doctors, what's the risk of getting COVID by an exposure? And a lot of them said 50%. It's a massive overestimation, right? It's probably in the range of 10 to 20%, depending on how close you are and how long. But again, if the Delta variant has changed all those equations, right? This is consistently, and you've heard this before, it's the most dangerous time to be unvaccinated in America because of the Delta variant. That's what we're seeing in our hospitals, 95+%. And so if the conversation, especially if you are unhealthy, if the conversation is vaccine risk versus COVID risk, I think the equation has to be get the vaccine.
Right, and I'll just add to that. I know there's been some leeriness because folks felt that the vaccines were authorized for use too quickly. The emergency use authorization for 3, and now Pfizer fully approved. And I think it's important to understand that the vaccines were still fully vetted, and there's so much data available now. Now so many more people, like Dr. Lozzi said, have been vaccinated where we have that information. And the FDA and those teams also review other processes such as the vaccine manufacturers. They work with independent laboratories for independent analyses. They want to make sure that vaccines that are produced in a consistent manner and are of consistent quality. So all that is also reviewed along with looking at safety in people and the reaction of people who receive the vaccine. And so now that they have so much more data, they were able to fully approve Pfizer, and I anticipate other vaccines will be fully approved sooner than later.
Okay, thank you so much. So I actually just noticed that we do have some questions coming in. So the first one is, I wanted to ask, how safe are we working together? Not everyone around me is vaccinated. So I guess the question is, what can we do if not everyone around us is vaccinated? what would be the best safety protocol, I guess, for stuff like that?
Yeah, I mean, sort of my take is, I mean, what we do in my office is 95% of us are vaccinated. There's, I think, two people that are not, and they have letters from their physician for why they're not going to get vaccinated. So we can't really force or mandate that. But I think what happens is that those individuals aren't allowed in common rooms, right? They stay in their offices and only in their offices. Entering and leaving the building, they have to wear masks. And again, I'm really strong about mask is no longer just a mask, and the Snoopy mask and the El Paso Strong mask, and even the Hispanic Chamber mask is no longer the mask that we should be using during this Delta period. It should be at the very least a surgical mask or a KN95, or there's comfortable N95s that you can get on Amazon. Those are actually the right masks to use. And apart from that, I think as Pfizer has gotten full FDA approval, you're seeing a lot more organizations, companies, and schools go to vaccine mandates. And then I think that is an appropriate thing for an independent company to do. Now, government, depending on the state you're in, governments and certain government entities can't do that, but I think independent businesses can do that. And the Methodist healthcare system in Houston has already faced two challenges to the Texas Supreme Court and won both of them when they mandated that they have to have vaccine. And that was back in July, right? They've won both of those challenges for those that are worried about the legal consequences. So I think there are a host of different ways to stay safe. I will say one thing though, and this goes to those that are vaccinated. Remember, you're vaccinated. And so on average, even if you're exposed, whether at work or in the community or by a family member, which often happens, you are protected by your vaccine. Have a conversation with your physician about whether you need a booster dose or not. If you get your booster dose, you're a little bit extra protected. And so I think at the end of the day, the vaccines are what allow us to return to life without that constant and consistent fear of getting sick enough to be hospitalized.
Right. Now, and I'll just to add to that, and I agree with everything that was said, especially with the independent, companies. It's tricky in academia, and we're not allowed to ask if someone's been vaccinated or not. So when we think about even our campus is open and we have common areas, and we can put up signage strongly encouraging, or in the building that we're in, since we lease space, we can mandate if our landlord says to, which we are. But we have to be careful. Unfortunately, this is a good thing, but we have to be careful that we don't pinpoint people. So then there was this idea a couple months ago before the fall semester started. Well, let's just say if you're not vaccinated, then you need to wear a mask. Now with Delta, everybody's wearing masks. But before it was, okay, well, if we make that recommendation, then will some people be targeted as if, oh, look, you didn't get vaccinated. Why didn't you get vaccinated? Then we found that those who are vaccinated were more likely to take extra precautions. We're wearing a mask anyways, but then they felt like, are people going to look at me and think I'm not vaccinated? It really got unnecessarily complicated. And so, the way I look at risk and reducing the risk of infection or transmission within the environment, if there's no exposure, there's no risk. That's pretty simple. We know we don't live in a sterile environment, but if there's a swimming pool that's contaminated with adenovirus and the chlorine wasn't sufficient, if I don't get in the pool, I can be standing right there. I'm not gonna, there's no exposure, there's no risk. So I promote, yes, talking with your doctor about your situation. And then also in your physical space, do what you can to reduce exposure. And it's that multi-barrier approach. So it's masking, it's the vaccination. Maybe if you feel comfortable, even if you are vaccinated, to still mask, because of what's happening with the Delta variant, and there's so many people who are still not vaccinated, then that could be an option as well. Avoid, social distancing, still avoiding the common areas, just all those things that we have just exhausted and we keep hearing about. But I think, what I took from the question, the way it was just worded, Stephanie, collectively, I think we do need to do a better job of this approach to combat this virus in this situation, and thinking about the scenarios we're in. And when I advise workplaces, I talk to them about people, places, and pathogen. Let's focus on the pathogen. For restaurants, we're talking about the foodborne pathogens, and then we're also talking about this one because people will take off their masks to eat. And then talk about people. Are you in a place that gets a lot of foot traffic all day long? Are you in an office that doesn't really deal with the public? And then the place. The nice thing about this virus, back in my world of looking at surfaces tabletops and computers and doorknobs. This virus has not been shown to effectively be transmitted through fomites, those inanimate surfaces. And part of that is because of its structure, and it's easily disinfected by just common, household cleaners and cleaners that we would use in an office setting. Unlike other viruses that are transmitted through the environment, I'll use this comparison with norovirus in cruise ships, right? We didn't close down the cruise ship industry when all these norovirus outbreaks started happening, many years ago. People threw up, projectile vomiting all over the cruise ship. It's highly infectious. It's easy to be transmitted because of the projectile vomiting. And that virus is also very hardy based on its structure. It's hard to disinfect and get it off surfaces, but we didn't close down the cruise ship industry. This virus, at least we do have some power in that we can mitigate it from our environment. But what I caution, because there aren't enough studies yet, is when we talk about the Delta variant and maybe other variants that likely have a higher viral load in aerosols, if you will, from an infected person. We do know that viruses in the environment on surfaces sometimes have increased survival properties if they're in higher numbers. So that's just something that's still yet to be realized. But I just still, focus on those 3 Ps of people, place, and pathogen, and thinking about your household and your workplace and what you can do to minimize exposure.
Okay, awesome. Thank you so much for answering that question. So I know that you guys, Dr. Lizzie mentioned the booster, and somebody actually has a question on that. So is getting the booster recommended? I got the Pfizer late January and the second dose mid-February.
Yeah, I mean, I think it all depends. I think that there is a category of individuals in the United States that need a booster. I think those are immune compromised, like Dr. Menna mentioned. I think older people with what we call senescent immunity, or immunity that's a little bit older, right? They do need a booster. And the reason is, if you really look at the data, we're sort of like Israel, right? So we're using Israel's data. But you compare it to the United Kingdom and Canada, that I think actually took a better approach than the United States did in rolling out their vaccines, and they spaced it 8 to 12 weeks. We probably pushed our 2 shots a little bit too close. We didn't get the right immune response. And so those that have that immune compromise, I think absolutely. I manage 1,500 lives of persons living with HIV. All of them are either going to get or have already gotten a booster dose recently. I think the FDA for now is talking about boosters for Pfizer, right? And hope Moderna submitted its paperwork, and hopefully they will be on track later in the year. There's a lot of questions about mix and match. I mean, the FDA doesn't advise it right now. I mean, what I am telling my patients is get whatever you have available to you outside of Johnson & Johnson. And then we have a lot of patients that got Johnson & Johnson as well. We're saying get whatever you got. I'm a little bit more hesitant about healthy people getting boosters because I just don't see the data. I don't see the efficacy data of it yet. And I really am sort of a global equity person in line with this. We can't do both. People keep on saying you can do both. You can't do both. You cannot. There's a finite number of vaccines. And so if you give to all the worried well in America that are worried about a cold and a sniffle and a temperature, you can't give it to India and Africa and South America. And I think it's really clear that if you look at where all the variants of concern and interest have come out of, they're not in the United States. They're in all these other countries that have had widespread, rampant spread and infection. We need, as the United States, and I'm going off a little bit of a tangent, to do a better job using COVAX and a host of others to get those parts of the world where more mutations and variants will spawn from. We need to protect us by protecting them. And so if you're older, get a booster. Immunocompromised, and there's a long list of things that make up immunocompromised, get a booster. If you're healthy, 30, 40, 50, healthy, I'm not necessarily sure you need to. Now, again, we live in the greatest country in the world, and one of the joys of America is that you can do whatever you want to do. I'm sure there are a lot of people that will get it just because, but I personally don't think the data supports healthy people getting boosters.
Yeah, I completely agree. And I also agree with the global equity, commentary there. And, I also, this reminds me, it's an example of, I don't want to say mixed messaging, but I think that it's, as the science is evolving, as we're learning more about the virus, it's been important to get the information out there. But unfortunately, now it's made some skeptics think, oh, and now they're changing the story. And so this example with boosters, a few months ago, I lose my time frame reference, but relatively recently it was talked about, oh, it looks like we're all going to be getting boosters, and there was a talk about that. And it goes back to that collective approach. We're all in this together, and for all of us to do this and be compliant, it's going to help everyone. But then it's, well, maybe not, maybe healthy people really shouldn't, because, right, there's a finite number of vaccines and there's so many people in the world who still need the vaccine. Let's focus on those who may need the booster to keep, everybody safe. But it's just it's a complex issue. And it's just another example, as this pandemic ensues, how it's difficult to get the information out, keep people, informed in a timely manner. But then I wish that there could be some patience and understanding about how, as the science evolves, it wasn't that someone wasn't truthful before. We just know, we know more information as time goes on.
Right, that's true. We get more information as time comes. And I guess the last question that I have, if anybody else has any other questions, please drop them in the chat. But one of the last questions that I have is, for example, for those people that haven't gotten COVID at all, right? A lot of them say, well, if I haven't gotten COVID, or maybe I got COVID and I fought it off, but I didn't feel anything, should those individuals still get vaccinated, even if they've never touched COVID ever in this time period? Is it still important for them to still be part of the movement as well?
Yeah, I think those are two different groups. You have to divide them. I think the group that has already gotten COVID, there is an argument to be made that their immunity may be long lasting. There's a host of studies that are coming out showing that natural immunity, or let me say vaccine induced immunity, is long and durable. I think, however, what my recommendation to that person would be is just get at least one shot. Right? Get one shot to boost. It's called hybrid immunity. You actually do a much, you get higher immunity rates than somebody that gets two shots. And so if that was their concern, I've already had COVID, why do I need two shots? Okay, go get one shot. I think the group of people that have not gotten vaccinated at all, different conversation. And I'm seeing a lot of those in the hospital. And I mean, the word I say at this point is it's tragic. It's tragic because it's avoidable. It's tragic because this is not last year when some people say, well, these are old people. These are sick people, as if old and sick people should just die. I've never understood that logic. But what I'm seeing now is 20-year-olds, 30-year-olds, 40-year-olds, people that thought they were healthy. And this is the kicker. You don't know if you're healthy if you've never been to a doctor, right? I have people that are 32, healthy, buff. They go to the gym every day. They come in and they, unfortunately, had uncontrolled diabetes that they never knew about. They thought that they were peeing all the time because they were taking a protein supplement and drinking one of their vitamin packs, and that's why they were peeing. And then you find out they have uncontrolled diabetes, and 2 days later, they're on a ventilator, right, fighting for their lives. You don't know what you don't know. And I guess at this point in time, and I think that's why we've seen vaccine rates go up over the last month, people are scared. And I think the number one thing, there's a host of studies that have shown this, the number one thing that drives somebody to get vaccinated if they're hesitant or they don't trust vaccines is, do they know somebody that's been hospitalized? So in our community, for example, we went through a tragic period, November into December. And so there's studies now that actually show that El Paso may have infected up to 60% of the population last year. That plus our vaccine rates are why we're doing so well. Right? You hear people saying this country's on fire, and we're like looking around, we're not. And I think we paid that tragic toll, right? And so, but I think at the same time, if you're not vaccinated, there's still a lot of unvaccinated people in El Paso, whether it's 100,000, 50,000, if a third of those, 10% of those come to the hospital at once, that's way too much for the hospital to deal with. And so again, we need to find ways to help people get there. I'm not into shaming people or saying you're a bad person because you didn't get the vaccine. It is what it is. They're actually benefiting from the amount of immunity that we have in our community. And so that's why it feels, well, in El Paso, somebody without vaccine can talk about that because our hospitals aren't full. CNN's not here anymore. But I think the person that's already gotten infection, I would plead with them to at least get one shot.
And I do too. And then that also reminds me of the number of people who have talked with me about the reasoning for not getting the vaccine is because they say they had an antibody test done and it looks like they had a previous infection, so therefore they don't need to be vaccinated. And that's a misconception. And there's there's more than I realize of people who feel that way. So I encourage everyone to get vaccinated.
And so, for example, that's a good point. Antibody testing. Even with antibody testing, you should still get the vaccine, even if it's just once, right?
That would be my
Absolutely.
recommendation. Yeah, absolutely.
Okay, awesome. Well, I don't see any other questions here on the chat. I'm not sure if anybody else has a question. I guess I'll give you a minute or two to type it out. But I think you guys have hit great points and made great points on everything that's been happening on the situation. I mean, the way you guys explained everything, I feel like I'm like a nerd now of everything. I know everything. Really good explanations. Let's see.
Hey, there's a question I see from a Melissa Holguin that I'll answer. And
Oh,
it's not a medical question. I think it's just a social, societal question, where she says, is it in the best interest of the community overall to limit the activities of the COVID anti-vaxxers? I mean, I try not to use that term anti-vaxxers, but I think as California has done, as New York has done, um, some policies and some politics, they're not medically based, may talk about vaccine passports. And I think there are pros and cons to all of those things. I think that I really do believe that it's in the employer's hands to sort of change some of these things in their workplace. Employers get to decide whether they want to have a mandate. And in healthcare, I mean, I laugh because apparently I've had a mandate all my life. To go to college, I had a mandate. To go to med school, I had a mandate. To go to residency and fellowship, and to work in any hospital in America, I had to get an MMR, Tdap, TB. I have to have those things, or I cannot walk in the building and see patients. And so it's intriguing to me that that's what we're arguing about. I think, however, that El Paso is not some of those communities, right? And so we may think differently philosophically. And again, like I said, we paid a heavy toll last year. We did what we do consistently. El Paso is one of the most vaccinated cities in America, not just in Texas, year after year, across the board, HPV, MMR. And so those two things combined have actually created a halo of protection for people that aren't vaccinated. Now, obviously, some are going to get infected and some will end up in our hospitals. But I'm not necessarily a fan of mandates on that end. And so it is what it is.
Right, I agree. And then following up, another question I see in the chat, what's an argument that we can give to someone who does not want to get a vaccine? I think it parallels what Dr. Lozzi just said. I mean, you're not only going to be protecting yourself, you're going to be protecting everybody else. And we think about our children back to school in person, those who are too young to get the vaccine right now. We need to provide that layer of protection. And so maybe that would be a simpler way to put it that could resonate with some people.
You know, Dr. Menna, I'll sort of piggyback off of that. I think not just that, but for people that have children, what the data shows really clearly is that in communities that have high adult vaccination rates, they have very low pediatric infection rates, right? So as a parent, as an adult, you may say, well, I don't care, I'm healthy, but by getting enough people in El Paso vaccinated, you protect the kids that are going back to school. And I think if that doesn't touch somebody, then the reality is that there's nothing that will. My guess estimate is that if you think about who's not going to get vaccinated in El Paso, probably 10 to 15%. And so that's still a good 100,000 people that are at risk for potentially serious consequences.
and then we got one more follow-up question. How can we spread more the reality of the vaccine instead of course, listening to all the misinformation that we've been seeing in the media? What do you think would be the best efforts for that?
I mean, things like this, right? And I truly do believe conversations. I mean, conversations, social media it's kind of a plus minus. You can do a lot of great things on social media. I've had people walk into my clinic. I've had people that I've seen in the hospital, like, oh, I saw you on TV and I got my vaccine because of you, right? And that's great. But the same people or the next two rooms down will say, no, I saw on social media that ivermectin is the best thing to do, right? Or the vaccine, as Azul says, causes brain inflammation. So, but I think these kind of conversations with trusted brokers like the Hispanic Chamber, with trusted people, Dr. Menna, there's a host of people around the community, Dr. Hendrick, Dr. Carranza, a host of others. I think those are the voices that we have to continue to amplify and say, hey, listen to people that actually know what they're talking about, that do this research, that see these patients. And let's have those conversations in an open and non-judgmental manner, right? And I think that really is the thing. When we make it a fight, when we make it a shame game or a blame game, you're never going to convince anybody to do anything that way.
Oh, well, thank you so much for all of that. I do see here that it is 10:43 already. So we haven't gotten any other questions besides that. Asol, thank you so much for your questions. And I want to thank both of you, Dr. Menna and Dr. Alozi. Again, you guys have cleared up the picture a lot. I think your responses were super helpful. And at the end of the day, it is about conversations, not the shame blame game, because it's true. A lot of people get more defensive than actually open up to different ideas that way. But I definitely want to give you a big thanks so much for joining us in this webinar, for talking to us, for answering our questions. You've helped us out so much. Thank you so much for joining us today.
Thank you.
Our pleasure.
Yes.
And everybody else, thank you so much for joining us. You all have a wonderful Thursday. Today is Thursday, so have a
Thank you,
wonderful
everybody.
Friday.
Have a great Thursday and Friday and a great weekend.
Bye-bye.
Take care.